Why older adults keep waking up at 3 a.m. and what it really means for your health and sleep. Waking up at 3 a.m. can be a frustrating experience for anyone, but it seems to be a particularly common occurrence among older adults. This phenomenon raises questions about the aging process, sleep patterns, and overall health. So, why does this happen and what does it signify? Possible causes. Changes in sleep architecture. As we age, our sleep patterns naturally shift. We tend to spend less time in deep sleep and more in lighter sleep stages. This makes us more susceptible to awakenings during the night. Circadian rhythm disruptions. Our internal body clock, or circadian rhythm, regulates our sleep-wake cycle. With age, this rhythm can become less synchronized, leading to earlier wake-up times and difficulty falling back asleep. Medical conditions. Several health conditions can contribute to early morning awakenings, including sleep apnea. This disorder causes pauses in breathing during sleep, disrupting sleep cycles. Restless legs syndrome. An overwhelming urge to move the legs, often accompanied by uncomfortable sensations, can interfere with sleep. Chronic pain. Pain can make it difficult to fall asleep and stay asleep throughout the night. Neurological disorders. Conditions like Parkinson's disease and Alzheimer's disease can affect sleep patterns. Cardiovascular issues. Heart failure and other heart conditions can cause nighttime awakenings. Urinary problems. Frequent urination at night, nocturia, can disrupt sleep. Medications. Certain medications, such as diuretics, corticosteroids, and some antidepressants, can interfere with sleep patterns and cause early morning awakenings. Lifestyle factors. Stress and anxiety. Worrying thoughts and racing minds can make it difficult to fall asleep and stay asleep. Poor sleep hygiene. Irregular sleep schedules, exposure to screens before bed, and a stimulating bedroom environment can disrupt sleep. Lack of physical activity. Regular exercise can improve sleep quality, so a sedentary lifestyle can contribute to sleep problems. Diet. Consuming caffeine and alcohol before bed can interfere with sleep. Deeper dive into the health implications of frequent 3 a.m. wake-ups. Consistently waking up at 3 a.m. isn't just a nuisance. It can have significant and far-reaching consequences for your health and overall well-being, especially for seniors who are already more vulnerable to age-related health changes. The disruption to the natural sleep cycle triggers a cascade of physiological and psychological effects that can accumulate over time. Let's explore these health implications in more detail. 1. Daytime fatigue and reduced function. Impaired physical performance. Lack of restorative sleep leads to persistent tiredness, making everyday activities feel more strenuous. Seniors might experience reduced strength, slower reaction times, and difficulty performing tasks they once found easy. Cognitive impairment. Sleep deprivation directly impacts cognitive functions like attention span, concentration, memory consolidation, and problem-solving skills. This can affect daily tasks, decision-making, and overall mental sharpness. Mood disturbances. Chronic fatigue can lead to irritability, frustration, and increased susceptibility to negative emotions. It can exacerbate existing mood disorders or even contribute to the development of anxiety and depression. Reduced quality of life. The constant struggle with fatigue and impaired functioning can significantly diminish enjoyment of life, limit social engagement, and reduce participation in hobbies and activities. 2. Increased risk of accidents and falls. Impaired balance and coordination. Sleep deprivation can affect balance and coordination, making seniors more prone to stumbles and falls, which can lead to serious injuries like fractures. Slower reaction times. Feeling tired slows down reaction times, increasing the risk of accidents, whether it's navigating the home, driving, or responding to unexpected situations. 3. Cognitive decline and dementia risk. Impaired memory consolidation. Deep sleep is crucial for consolidating memories. Frequent awakenings disrupt this process, potentially contributing to memory problems and increasing the risk of age-related cognitive decline. Increased risk of Alzheimer's disease. Emerging research suggests a link between chronic sleep disturbances and an increased risk of developing Alzheimer's disease. While the exact mechanisms are still being studied, disrupted sleep may interfere with the brain's ability to clear amyloid beta plaques, a hallmark of the disease. 4. Mood disorders, depression and anxiety, bidirectional relationship. Sleep problems and mood disorders have a complex, bidirectional relationship. Chronic sleep disruption can worsen existing depression and anxiety, and conversely, these conditions can often lead to difficulty falling asleep and staying asleep. Increased severity of symptoms. For seniors already struggling with mood disorders, persistent sleep loss can intensify their symptoms, making them more difficult to manage. 5. Weakened immune system, reduced immune cell function. During sleep, the body produces cytokines, proteins that help regulate the immune system. Chronic sleep deprivation can reduce the production of these vital proteins, weakening the body's ability to fight off infections. Increased susceptibility to illness. Seniors experiencing frequent 3 a.m. awakenings may find themselves more prone to colds, flu, and other infections, and their recovery time may be longer. 6. Increased risk of chronic diseases. Cardiovascular problems. Chronic sleep deprivation is linked to an increased risk of high blood pressure, heart disease, stroke, and irregular heart rhythms. Disrupted sleep can negatively impact blood pressure regulation and inflammation levels. Type 2 diabetes. Poor sleep can affect insulin sensitivity, making the body less effective at regulating blood sugar levels and increasing the risk of developing type 2 diabetes. Obesity. Sleep deprivation can disrupt hormones that regulate appetite, potentially leading to increased food intake and weight gain, which further increases the risk of other health problems. Chronic inflammation. Persistent sleep loss can contribute to chronic low-grade inflammation throughout the body, which is a contributing factor to many age-related diseases. 7. Increased mortality risk. Long-term consequences. Studies have indicated that chronic sleep disturbances, including frequent nighttime awakenings, are associated with a higher risk of overall mortality in older adults. This highlights the critical importance of addressing sleep problems. In summary, frequent awakenings at 3 a.m. are not a benign inconvenience for seniors. They can have significant and cascading negative effects on physical and mental health, increasing the risk of accidents, cognitive decline, mood disorders, weakened immunity, chronic diseases, and even premature mortality. Therefore, it is crucial for older adults experiencing this issue to seek medical advice and explore strategies to improve their sleep quality. Addressing the underlying causes and implementing effective sleep hygiene practices can have a profound positive impact on their overall health and well-being in their later years. Navigating the 3 a.m. wake-up. Practical steps for seniors. Waking up in the dead of night, especially around 3 a.m., can be frustrating and disrupt the restorative sleep you need. While identifying the underlying causes is crucial, as discussed earlier, here are practical steps seniors can take in the moment and over time to manage these awakenings and improve their overall sleep. In the moment when you wake up at 3 a.m., resist the urge to panic or get anxious. Waking up in the middle of the night is common, especially as we age. Try to remain calm and avoid getting worked up about being awake. Anxiety will only make it harder to fall back asleep. Stay in bed. Initially give yourself about 15 to 20 minutes to see if you naturally drift back to sleep. Avoid immediately jumping out of bed and turning on lights. Keep the lights dim. If you do need to get up to use the bathroom, keep the lights as dim as possible. Bright light signals to your brain that it's daytime, further disrupting your sleep cycle. Consider using a night light. Avoid clock watching. Resist the urge to constantly check the time. This can increase anxiety and make you feel more awake. Turn your clock away from your line of sight. Engage in a quiet, relaxing activity. If you can't fall back asleep if you've been awake for more than 20 minutes and don't feel sleepy, get out of bed and do something quiet and relaxing in dim light. This could include gentle reading. Choose a non-stimulating book or magazine. Avoid suspenseful or action-packed material. Listening to calming music or a podcast. Opt for soft, instrumental music or a soothing spoken word podcast. Light stretching or deep breathing. Gentle stretches or deep breathing exercises can help relax your body and mind. Mindful meditation. Focus on your breath or body sensations to quiet your mind. Avoid screens. Stay away from your phone, tablet, or television. The blue light emitted from these devices can suppress melatonin production, making it harder to fall back asleep. Don't eat a heavy snack. While a very light snack might be okay if hunger is keeping you awake, avoid eating a large or heavy meal as it can disrupt digestion and sleep. Stay hydrated, but not excessively before bed. If you feel thirsty, take a small sip of water. However, avoid drinking large amounts of fluids close to bedtime to minimize nighttime trips to the bathroom. Go back to bed when you feel sleepy. Only return to bed when you genuinely feel tired. Don't force yourself to lie in bed awake, as this can create a negative association with your sleep environment. Long-term strategies for preventing 3 a.m. wake-ups. Establish a consistent sleep schedule. Go to bed and wake up around the same time every day, even on weekends, to regulate your body's natural sleep-wake cycle. 2. Optimize your sleep hygiene. Create a relaxing bedtime routine. This could include a warm bath, reading, listening to calming music, or gentle stretching. Ensure a comfortable sleep environment. Make sure your bedroom is dark, quiet, cool, and has a comfortable mattress and pillows. Limit exposure to blue light before bed. Avoid electronic devices for at least an hour before sleep. Consider using blue light filters if necessary. Avoid caffeine and alcohol before bed. These substances can interfere with sleep quality. Limit caffeine intake in the afternoon and avoid alcohol close to bedtime. Get regular exercise. Physical activity can improve sleep, but avoid intense workouts close to bedtime. Aim for exercise earlier in the day. Manage stress and anxiety. Practice relaxation techniques regularly. Incorporate deep breathing exercises, meditation, yoga, or mindfulness into your daily routine. Address underlying stressors. Identify and address the sources of stress and anxiety in your life. Consider talking to a therapist or counselor if needed. Maintain social connections. Social interaction can help reduce feelings of loneliness and stress. Optimize your daytime habits. Get adequate sunlight exposure. Sunlight helps regulate your circadian rhythm. Aim for at least 20 to 30 minutes of sunlight exposure during the day, preferably in the morning. Maintain a healthy diet. Avoid heavy meals close to bedtime and ensure you're getting a balanced diet throughout the day. Stay hydrated throughout the day. Drink enough water, but limit fluids in the evening. Address underlying medical conditions. Consult your doctor. If you suspect a medical condition is contributing to your sleep problems, seek professional medical advice. Treating underlying conditions like sleep apnea, restless leg syndrome, or chronic pain can significantly improve sleep. Review medications. Discuss your medications with your doctor to see if any could be affecting your sleep. Consider cognitive behavioral therapy for insomnia, CBTI. This is a structured therapy program that helps individuals identify and change negative thoughts and behaviors that contribute to insomnia. It's a highly effective treatment for chronic sleep problems. Important note for seniors: be patient and consistent with these strategies. It may take time to see significant improvements in your sleep patterns. If your sleep problems persist or worsen despite trying these approaches, it's essential to consult with your doctor for a comprehensive evaluation and personalized recommendations. Don't hesitate to seek professional help to regain restful and restorative sleep. If you find yourself consistently waking up at 3 a.m., it's important to address the issue. By identifying the underlying causes and making lifestyle changes, you can improve your sleep quality and overall health and well-being. Disclaimer: this information is for general knowledge and informational purposes only and does not constitute medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions regarding your health or treatment. Ongguan va noi dung lin quan.